Can you give our listeners kind of Reader's Digest condensed version of how appliance therapy works? So let's make the assumption that we're starting from ground zero on baseline on learning about appliance therapy.
Okay, so the fundamental method of how effective appliance therapy is basically if we take the jaw and we move it forward, we know that the tongue is attached to the mandible. And when we move that forward, it will actually increase the surface area of our airway. So we actually physically, by moving our mandible forward, moving the jaw forward, we're actually increasing the surface area of our airway. So what's happening, remember, is when we go to sleep, our airway is collapsing. And so there's no patency in the airway. But if we can increase the surface of the airway and we can keep our jaws in that more forward position, then even if you have some collapse because of muscle tone when you're sleeping decreasing, you still can have patency of the airway, and it's enough that it'll ameliorate the sleep apnea. And so all the different appliances, whether it's over the internet or you're making them custom or whatever you're doing with them, that's how they work. And that's an amazing way for them to work. I mean, we used to have an appliance that didn't work on your jaw. We just pulled your tongue right out of your mouth with like a turkey baster. It looked like the end of a bulb of a turkey baster. And that was very effective, except everybody hated it, just like they do CPAP. So nobody tolerated that. So what we have now with oral appliance therapy is a very comfortable way to move our jaws forward and keep them there, and also help to treat the sleep apnea. And that's basically how it works. And there's all different designs on how to do that. We can go into that if you want to do, but that's how.
Yeah, I loved it. What do you talk about the designs that you use in your practice?
So the main design that I usually use, it's called a dorsal fin design. And there's a few companies many companies make this type of design. They make them different ways. But there's what we do is you take the jaw, you put an appliance. It almost looks like a night guard if you've never seen any of these. It would look like a night guard with like a 2 posts sticking up in the back, maybe in the molar region. And then you would put another night guard, say, on the maxillary teeth, and that would have posts going down also in that same, and the mandibular post would be just anterior to the maxillary posts, so that when you went backwards, it would keep you in a forward movement and you couldn't go backwards. But it would allow you to, move around the posts or have enough length that even if you opened up a little, it would still keep you postured forward. So you'd be able to move around, right and left, go into those movements. You certainly can go forward, and you could even open a little and it would still be effective in those positions. And that's the main type of appliance, without getting into insurance, but I need to a little, because some of these patients have Medicare, and Medicare, unfortunately, in their formulary don't allow for those types of appliances. So then there's other types of appliances like the old standard Herps types appliances for any people that are doing orthodontics. These are old standard Herps types appliances. They do the same thing. So we can use those as sleep appliance as well. There's another appliance. There's a tap appliance where the connection is in the front. It's in the interior. Great for patients that don't have any posterior teeth. So there's different appliances that have different ways of basically protruding the mandible. And those are some of the different, easily enough just to go on the internet and you can see great examples of all those.
Right.